turn the light on for me? We forgot to do that last time.
Ah.
Oh, I'm all bright now.
Yes, you are.
Hello. It is Lunch and Learn with me, Dr. Polly Heil-Mealey, with Abundant Health and Wellness. Now, our clinic is located at 323 East Main Street in downtown Humble. So, I don't know, we're doing a sound check. Can anybody hear me? Yeah? Are you hearing me? We've done this before and nobody heard me, which is kind of a waste of time. So this is in the lobby of our clinic, and we have people coming in, we have people leaving, so there's going to be some noise. The phone is going to be ringing and that kind of thing. So it does sound like we have sound. Yes. That's a good thing. So today what I want to talk about is our immune system, okay? Our immune system is something, a lot of people will talk and they'll say, we want to boost your immune system. Well, that's really kind of a misnomer. You don't want to boost your immune system, because if you boost your immune system, that means you've got some kind of sickness and disease, because the immune system is boosted in order to take care of sickness and disease. So we want to strengthen, hi Alva, we want to strengthen our immune system so that when the challenges come, we're able to deal with it. So I want to talk about some negative communication, some negative events, some negative processes, right, that weakens our immune system. So that's what we're going to talk about today. Communication breaks down, and it breaks down what's going on in the body. So let's look at some negative states. So one thing that we're all very familiar with is bereavement. Now, bereavement, we think about just being if someone dies, but bereavement can also be sadness. We could lose a friend could move away, we could not get that promotion we wanted, we could not get the job we wanted, we could be overworked. Hey, Daniel. A lot of things. And these things cause grief in the immune system. And what happens is it causes lymphocytes to diminish. So what is a lymphocyte? So I want to read some information. I've got all kinds of information here so I can give you really good info. Lymphocytes are cells in your white blood count. So when you get your blood work done, and the doctor, especially if you do a comprehensive blood analysis, you're going to get your white count. Now, if your white count is too high, that's because of sickness and disease. If your white count is too low, that's because of sickness and disease. So two of the components in your white blood count are your B cells and your T cells, right? So when you have this test done, it will tell you how many lymphocytes you have. Now, that lymphocytes is two numbers in your blood work. There is the lymphocytes absolute and the lymphocytes percentage, and there is a reference range for that, and you need to be in that reference range. So when you are in a negative state of bereavement, then the lymphocytes diminish, okay? So you have to have a lot of lymphocytes in your body, the white blood cells, so that when an invader comes, you've got those little soldiers out there to run to your defense. And Tracy's throwing things over there. So that's what you just heard there. Okay, so what about pessimism, right? There is optimism. That's somebody who sees the glass as half full, and that's me. I'm very chipper, as my radio host told me this week, that he said, that's just an old-fashioned word. It was like, yes, because I always see the glass half full. But then we have people that I know, I've got people in my family that always see the glass half empty, and so that's pessimism. So a pessimistic state decreases lymphocyte activity, it decreases T cell activity, and it makes the T cells that you have very ineffective. So remember, the T cells go after the parasites, the viruses, the germs, and that kind of thing. So if you're negative, if you're always talking negative, if you're always feeling negative, then you're diminishing your immune system, so that's important. It's the summer, and so not many people have this. Maybe Tracy, because she's studying to work on her nutritional certification, right? And so academic stress lowers your immune system. So your academic stress decreases your natural killer cells. It decreases your T cells. It decreases your immune chemicals, and it increases the susceptibility to the herpes virus. So anybody that's ever had a cold sore or the chicken pox, you've got the herpes virus. Okay? And so we know people that when they get under extreme stress conditions, they'll break out in a cold sore, right? So that's because when the natural killer cells deplenish, when the natural T cells deplenish, then you're going to get that virus that's going to be able to rise and to be able to poke his ugly head out, and you're going to get a fever blister. So a lot of people will resonate with this, and when we have people that come into the clinic and they've got mouth ulcers and that kind of thing, I always ask them what kind of stress they're under, and normally they say they're under great stress. So academic stress is one of those things that will diminish your immune system. Now, we've got a supplement called L-lysine, which is really good for those cold sore breakouts, and it keeps the herpes virus in check. So let's talk about your natural killer cells. They're also known as NK cells. They're also known as K cells, and they're also just known as killer cells. So these are types of lymphocytes in where? The white blood cells, okay? And they are a component of your innate immune system. Your innate immune system is the immune system that you are born with. It's already in there. God already made it. And the NK cells are the cells that are in there. Now, these NK cells have two different proteins. Now, one is a protein called perforin, P-E-R-F-O-R-I-N. I don't know if I said it right, but that's what I think it is. And then the other protein is called protease. Now, we've been talking about protease a lot on our Facebook Live because protease is this enzyme that will eat up cancer cells, it will eat up mucus, it'll do all kinds of good things. And so the natural killer cells already have protease in them. And so when you are having academic stress or bereavement, or you're pessimistic, then you're depleting these natural killer cells in your body. Now, if you are under great stress, and a lot of people are under great stress these days, we do have a formula here in the clinic that actually will boost your natural killer cells. And we have cancer patients that have beat cancer, but they take these supplements to keep their natural killer cells up. So that's just something to think about. Depression. How many people are depressed, right? A lot of people are depressed. Depression, if you look at the ads on the television for all the antidepressants, Abilify, Wellbutrin, all those different wonderful drugs that are out there, right? Of course, we don't recommend that, but it's all over the place. So depression depresses your immune system. So depression decreases your T cells, right? It increases the blood levels of the Epstein-Barr virus. So Epstein-Barr virus is the virus that is behind mononucleosis, otherwise known as the kissing disease, right? It is estimated that 97% of Americans, North Americans, right, so that would include the Canadians and the Mexicans, right? These three people groups, 97% of adults are infected with the Epstein-Barr virus. So if you're fighting depression and you're on these antidepressants, you are losing your immune function, and that is allowing the Epstein-Barr virus to manifest. So we don't want to have that, okay? It also decreases your immunoglobulin A, right? So what are immunoglobulins? Well, we've got a paper here, okay? You can Google it, but this is from the WebMD. So IgA, or immunoglobulin A, is about 10. Hey, Kim, thanks for joining. The immunoglobulin A is a larger antibody, and it protects the body from outside foreign invaders. So when you go out and people are sneezing, when you go out and you touch something that's dirty, well, it's the IgA that protects you. So when you're depressed, the IgA is depressed, and so your immune system is weakened, and so then you become sick. So just think about the last time you were ill. Were you going through a negative state? Were you going through depression? Were you going through a trauma of some kind? You know, life hits us with all kinds of trauma, and we don't always, we never invite it, right? We don't invite it, but it kind of catches up with us unaware. So we need to be aware that when that happens, we need to be very kind to our body so that we don't depress our immune system. So what about loneliness? What about people that are lonely, right? So I've been lonely before. I was single for a long time, comparatively speaking. When I was a young person in college, everybody got married out of high school and into college, and I was out of college before I got married. So there were some years of loneliness where I felt very unloved and, you know, unappreciated and all those kind of things. Then when I became a widow in 1999, there were several years of just loneliness. So when you're lonely, you decrease your natural killer cell activity. So depression and loneliness, they kind of go hand in hand, don't they? Right? Chronic stress. Chronic stress decreases your T cells. It decreases your natural killer cells. It decreases your B cells. And it increases your blood levels of the Epstein-Barr virus. So the Epstein-Barr virus can be really, really deadly. And the Epstein-Barr virus is at the back of a lot of autoimmune disorders. And so you can see by looking at these things that your immune system takes a real hit. So what if you're pessimistic? What if you're lonely? What if you're depressed? What if you're in a chronic state of stress? What if you can't be bothered to cook good food for yourself? What if nobody loves me, so I'm just going to stay in bed with my book and put the covers over my head, right? So those are kind of things that we deal with. So we've got to take good care of ourselves. We have to make sure that we eat properly. We have to make sure that we get those amino acids, that good protein in, so that we can make our own protease, we can make our own enzymes, so that we keep our immune system strong. Let's think about some other stresses, because life is very stressful. What about divorce, separation, or a poor quality of life? Hello, Pastor Nelson. Thanks for joining us. These things that we see all the time. We see separation. We see division. We see strife. All of those things depress your immune system. So it decreases your lymphocyte production. It increases your Epstein-Barr virus levels in the blood. It decreases your T cell effectiveness, and it also decreases your natural killer cells. So what is one of the best things that you can do? Well, remember, the Bible says that a merry heart does good like a medicine, right? So if you are sick, if you are depressed, if you are pessimistic, then what we need to do is get a little bit of laughter in there, because laughter boosts your immune system. Laughter strengthens your immune system, so we want to see that that happens. What about the expressed, hey Jeanette, thanks for joining. What about the expressed need for power? We all have those people in our lives that, I am the person in charge, you must do what I say, all those kind of things, right? So if people have an expressed need for power, or they're the bossy people, right? We all know bossy people in our lives. Well, those bossy people are not happy. They have also a decreased natural killer cell activity. They have decreased lymphocytes. So when you're looking at your blood work, if your blood work shows that your white blood count is either too high or too low, you want to consider, are you operating in this depressed state? Are you operating in a situation where you just feel overwhelmed? Are you functioning in a situation where you just think nothing's going to get better? Because when that is your reality or your perceived reality, then what that does to your body is it takes your immune system, it just crashes it. So think about this. I've had this in my life. I've had periods of, hey Sandy, I've had periods in my life where I've been stressed. Not necessarily a good stress or a bad stress, just a stress. I'm thinking about when I was a teacher and I was a principal, and then we would have the end of school. So we've got graduation, we've got finals, we've got STAR tests, we've got this, and this, right? So it's a real area of stress. And so we'd, just shore everything up, we hold everything together, we get through the graduation, and then we just fall apart. We just fall apart. We have 2 or 3 days where we just stay in the bed. We may come down with a cold. We may come down with a fever. We may come down with who knows what, because the pressure is off and your body says, I can finally breathe. But what has happened is all of that stress has lowered your immune response. So whatever outside invaders are out there, right, they are very opportunistic, and they come in when your immune system is depressed. So we don't want to do that. Let's talk about negative discussions, right? I am not somebody who likes to have negative discussions. I only like to have positive discussions. So negative behavior during a discussion, particularly of marital issues, decreases your natural killer cell activity. It decreases the macrophage activity. Now, macrophage, Sandy is watching from Alabama, so our footprint is getting bigger. Thank you, Sandy. When you're having these negative discussions, right, it decreases your macrophage level. So your macrophage, that's another kind of white blood cell, and it's kind of like a little Pac-Man. It eats up the germs, it eats up the bacteria, it eats up parasites, right? So when you're having these not so happy conversations, it decreases the macrophage activity, so your Pac-Mans kind of go to sleep. Hey Kim, thanks for joining. So we don't want to have our macrophages go to sleep, right? The lymphatic system is the vacuum cleaner of the body, and all the white blood cells go through the lymphatic system. So if your macrophages, you've got phagocytes, right? That's kind of a funny word, but that also, both of those cells eat up bacteria, eat up germs, eat up viruses, and that kind of thing. So if you're stressed and you're having these confronting conversations, you need to learn how to confront without lowering your immune system. So besides losing your macrophages, right, you also are increasing your blood levels of the Epstein-Barr virus. So we don't want to do that. Epstein-Barr virus is a killer virus. It's something that, like I said, 97% of North Americans have it, the adults. So you have it. It's in there. We don't want it to get the best of you. We don't want it to raise its ugly head and for you to be sick. So what you need to do is work on your immune system. So how do we do that? You might think that you want to go to your doctor and get some antibiotics, but that's really not what you want to do, because the antibiotics kills all the good bacteria, and you have to have good bacteria in your intestinal tract in order to have a strong immune system. So what can you do? Well, you can look at good, clean comedy channels and laugh a lot. Laughter raises the white blood count, and we'll talk about that next week, because I think we're kind of running out of time, and we'll talk about that next week. But you want to do some really proactive things. You want to get enough rest. You want to make sure that you're eating good foods. You want to take some supplements that will increase your natural killer cell activity. So one of the things that we've been talking about in the last few weeks is enzymes. Now, we take enzymes with our food, but we can take enzymes between meals, and what those enzymes do is they're natural chemical catalysts that cause our immune system to be strengthened. So these are some things that you can do, some practical things you can have in your emergency medical kit at home, right? You can have some wild oregano capsules. We're not talking about wild oregano essential oil. That's a different animal altogether. But you can have some wild oregano capsules, and what that will do is it is a natural antibiotic. It is a natural antiviral. So when you feel like you're coming down with something, you just take one of those every hour or every 2 hours, and then by the end of the day, you'll be fine. We've got some natural silver, elemental silver, and nanotechnology. Now, I'm not talking about colloidal silver. I'm not really a fan of colloidal silver because colloidal silver has a particulate and it can settle out of the solution. That's a kind of a complicated thing, but just trust me, you don't want to have that. The silver in the nanotechnology is very, very stable, and it will not turn you blue, and you can put it everywhere. You can take it internally for mucus issues. You can take it for any kind of viral. It's an antiviral. It's an antibacterial. In fact, there's a patent. Don't tell anybody, but there's a U.S. patent that shows that this particular brand of silver that we actually carry in the clinic will cure HPV virus infections, right? So this is something that you need to know. If you have that virus, then you need to know how to get rid of it. So we've got natural silver nanotechnology that will take care of that. We also have a herbal formula called IVH, which is for infection and virus. And so when you feel like your immune system needs a little bit of a boost, those are some things that you can do. So I'm going to say goodbye for now. We've got people all over the office, and so I need to go and take care of them. But I will see you next week on our Friday Lunch and Learn. Thanks for joining. Please share with your friends.